Hello, it's Anthony Chadwick from the Webinar Vet, and this is VETchat, the #1 UK veterinary podcast. I'm so pleased today to have two people on our episode today. We have Ian Battersby&Margo Mosher, who both work for MARS. Margo is the Global Sustainability Director, and Ian is the responsible Pharmaceutical Stewardship Lead. We're wanting to talk today all about antibiotic stewardship. It's an incredibly important area. I remember several years ago being at a conference in Dublin where one of my mentors, Professor David Lloyd from the Royal Veterinary College, was talking about antibiotic stewardship, and it was in a small room and there weren't that many people in there. But of course, we know that our usage and our stewardship of antibiotics and all products is really, really important. And I'm so pleased, Ian, to see that this is something that's really moving up the agenda as something that we've really got to take seriously, isn't it?
Oh, absolutely. Pharmaceutical stewardship, it's a bit of a tongue twister to say. You're not the first one to have difficulties pronouncing my job title, but pharmaceutical stewardship is really, you break it down into two arms. The first one is promoting good use of the drugs to get good clinical outcomes. So that's using the right drug at the right time via the right route, and optimizing all the non-pharmaceutical aspects. I guess when you're resolving an infection, making sure there's good drainage, removal of necrotic tissue. So that's the first part of it. The second part is making sure that when we use these pharmaceuticals, we don't cause harm to the patient. So that can be either an acute side effect, some of which we're familiar with, or chronic effects, and then also for future patients. So when we're talking about future patients, that's focusing on the environmental impact of some of these resources that we use. Are we using them too much or not enough? And are we disposing of them in the right way? And then also making sure that the efficacy is still available for future patients. So we will still have these drugs available to use on patients in the future when we need them. And it's, I can certainly reflect on, 10 years ago, when I first started getting focused on antibiotics, like similar experience to you. I was, almost like a lone wolf in certain lecture theatres and stuff, and it was a very new topic. But it's pleasing to see now that this is gaining momentum. It's really important that it gains momentum, but it's really pleasing that we're getting a lot of engagement now across the profession.
And I think it's also interesting, Margo, there's a real sustainability element to this as well, because the antibiotics can be disposed of incorrectly. That can cause contamination of the environment and damage other ecosystems as well, can't it?
Exactly. The use of pharmaceuticals, their production, their shipping, their disposal, every aspect of the life cycle of pharmaceuticals has impacts, both environmentally and socially. But thinking about the environment, yes, the impacts through waste, on water, on greenhouse gas emissions, really overall creating our drugs and then using them has impacts. And so managing those carefully and being really good stewards is critical. And one example, just to give a sense of some of those environmental impacts, to create 1 kilogram of vancomycin, an antibiotic that isn't used as much lately, but has been historically, to create that 1 kilogram, you need over 500 kilograms of inputs, largely water, but other inputs as well. And that production of the drug emits greenhouse gas emissions over 50 kilograms for 1 kilogram of the drug. So just to give a sense of the creation of these drugs does have those impacts. And so using them unnecessarily causes all of those impacts and that footprint. So if we can be really judicious about their use and use them only when needed, we can not only help animal health, human health, but also that environmental side, and really looking at this issue as a one health issue that has impacts across all of those different areas.
I think it's really important. And for me, the key word is that responsible usage, because certainly, I've been a vet for 32 years. And when I went into practice, sometimes I would see practices using antibiotics in a cavalier way. A cat had been castrated. That operation was done in as clean a fashion as possible, but there was still a feeling that we had to give half a mil of something white and milky, which was usually a penicillin type product. And there really is no need for that. We did a webinar recently with somebody else, and they were talking about use of antibiotics in diarrhea. Often we don't need to use antibiotics, but maybe because we've not been taught well, or we've learnt bad habits once we've got into practice, it can be very easy to fall into those traps. And I suppose sometimes also clients kind of expect something more than just a chat with the vet and an examination. They want to go home with something, don't they, Ian?
Yeah, and it's it's a complex matrix really of all the different factors that go into when we're actually in the consult room prescribing a medication. There's all the information and guidelines, there's previous experiences that may be good or bad. I can remember when I was a younger vet developing habits from one case going bad, so then I started using a pharmacy of drugs because of that one case, but that was an unusual event. But it molds your experiences. And one of the biggest challenges is, with this particular type of conversation is, if I talk to a vet about adding in a drug that might help them, and maybe minimize a risk, that's one thing that's easier to do. Taking away a drug because it's not necessary, that's a different psychological challenge. And so it's really, we've got to, we know this is, we know this is an issue for antibiotics. We know there's areas, for example, where antibiotics aren't indicated. You've used acute diarrhea as a very good example. So it's really about, as vets, we need to make sure there's a culture within the hospital that's supportive, that there's consensus. I get vets talking to me all the time saying, I'd like to do this, but then if I don't do it, I don't get the support. I get put in they'll go and see another vet and then they'll prescribe. So it's all about getting consensus in the hospital, really. And also I think, one thing we touched on in other podcasts is that, a lot of the course durations that we prescribe as vets have been arbitrary, allocated to multiples of 5 or 7, and I can't believe that, a bacteria is going to respond to a multiple of a calendar week. So we really need to, there's a lot of research in human medicine on shortening courses of antibiotics, and we need vets really to submit clinical cases to studies, that are starting to be initiated across the profession, looking at shortening these courses really, so that we can only use these drugs when necessary, but also only for as long as needed.
And I think it's interesting for those people perhaps not aware listening. Obviously, Ian, you work in the UK for Linnaeus as well, which is the big veterinary group that MARS own, and then obviously there's veterinary groups in America, obviously also owned by MARS. That's a real power for good because there's so many practices. You're obviously taking this area so seriously that you can get that good information out, and it becomes something that's a policy. If there's an acute diarrhea, we shouldn't give antibiotics. But it's always been very difficult, as you said, even within practices. And again, to use a derm example, I would often be looking at, as a referral vet, at a case that had come from a practice, and there'd been 5 different approaches to it, and some of them were obviously better than others. So trying to get that standard of saying, we shouldn't use this antibiotic unless there is these 2 or 3 reasons, I think is really important. We can be quite prescriptive, I think, within use of products like this that obviously are ones that we want to save for future generations. We're not only, as you said before, treating the animal, we're treating future animals as well by our behaviors, aren't we?
Yeah, and you're quite right. I mean, the exciting thing about my role is that, MARS, I think we have about 2,700 practices. Is that right, Margo? I think it's around about that number, and it's over a number of continents. So collectively, the impact we can have as a group is it's hard to put into words, really. But also, you're right about the challenges on getting agreement within the practice. And one measure that we put in place in Linnaeus is the Protect scheme, which I was involved with. Part of the BSAVA Protect scheme is that we give you a number of different options for each condition. So you can be involved in the choice of antibiotic or not to use an antibiotic in a list of situations. So simple measure that we put in place at Linnaeus is that each practice had to discuss sections of the poster at their practice meetings. So you talk about tea and coffee rotas, things, and all the other bits and bobs, insurance forms, and then 10 minutes at the end of each practice meeting. Right, we're going to talk about this section of the poster, and we're going to, that might be the GI section, and we're all going to agree on what we're going to use. And then the next meeting, they moved on to the next section, and that generates conversations between colleagues, and consensus really.
Yeah, I think it's really important, the conversations, isn't it? Because there's certainly practices that very rarely held meetings, and actually meetings and comms are very important, because if you're all in separate consult rooms or even in separate buildings, actually communicating as a team can be incredibly difficult, can't it?
Yeah, no, absolutely. It's all, lots of change can be made, but if you're on your own and you're not, you've not got that collaboration and supportive culture, it's really hard. Really hard.
How do you see Linnaeus and the larger MARS group across continents? Do you see that you have an obligation towards research? Because things like how long should we give a course of antibiotics is, you're quite right. We still don't actually know. Some of it is a bit of empirical guesswork, isn't it? Is there some work going on at some of your referral centres and so on? Maybe working with universities to try and get further into this?
So, one of the first things we're trying to do is understand our baseline usage. So, we're collaborating, with all the different business units, getting, benchmarking on the amounts that each hospital is using. And that piece of work's being done with Dr. Scott Wees, who hopefully some of your listeners are familiar with, World Authority on Infectious Disease, really nice guy, incredibly bright and intelligent. So he's been an incredible asset in this. So we're, within that, we're doing some analysis at the moment. We're understanding our usage patterns, and then, certainly that will steer us towards different initiatives that we will want to put in place. And certainly, what we'll want to do with that is assess the impact. Try different ways of delivering, because essentially a large part of this work is communication. As we talked about. So, if we can put education platforms and things like that in place, and look at the changes in prescribing behaviours, well, that information, will be incredibly powerful for the profession. So we can distribute that information when we get it. So there's certainly a number of, we're just completing that analysis at the moment, and then, the next couple of months we'll start working on areas that we want to focus on, and then start putting those plans in place. And it's not a quick process, but with the number of practices that we've got, it's potentially very powerful information because of the number of animals. A lot of veterinary studies have very small number of animals, whereas if we can look at 100,000 animals, wow. Yeah.
Just for those listening, Scott is a lecturer up in Ontario, in Guelph. He has done some webinars for us, so do go and have a little nose if you want to catch up on more sort of information about that. You're absolutely right, though. With anything, and I know, Margo, you've done a lot of work, looking at carbon and sustainability. The first thing you have to do is measure your carbon, isn't it? Or measure whatever. In any study, you have to know what your baseline is.
Exactly. That's the very first step, and something we've been working on in our other topic areas, climate change and our greenhouse gas emissions, also hospital waste. So doing those footprints or baselines is critical to be able to not only measure and track your progress annually, but just to know where to be focusing, and really looking at where are the biggest impacts coming from, where are there anomaly cases happening. So across all three of these topics that we've touched on, starting with your measurements, so that you can build the right plan and have really a strategy that's based on the evidence of where the impacts are. So what Ian described as these first baselines that we're doing are just critical first step to understanding, okay, what is our picture when it comes to our antibiotic usage, and where and how can we focus to optimize and really be using these drugs wisely. So key first step for us.
I remember a number of years ago, the Dutch government just mandated that vets had to reduce their antibiotics. I think it was by 50%. So that these sort of things are possible. And I know that the Dutch vets came together and did an amazing job. Sometimes there's a danger that vets can be blamed for, antibiotic resistance and things because of antibiotic usage. But this is the true One Health issue, isn't it? Because this is use of antibiotics by humans, by animals or for animals as well. How do you think that government can get involved and sort of help with this as well? Ian or Margo?
Right.
I'm sure you both have an opinion.
Margo, sorry, I'm taking the lead there, aren't I?
Go
Sorry,
for it, Ian. Go ahead.
All right, okay.
Go for it.
So, I mean, certainly from a UK point of view, we know the UK is taking this issue very, very seriously. Dr. Sally Davies is a very prominent advocate of responsible antibiotic use. And I think there's a 25-year plan, and also and within that, there's a 5-year plan that's annually reviewed. And there are touch points within that impact on the veterinary sector, predominantly farm animal, but those kind of initiatives will obviously cascade into companion animal as well. But we also know that there are discussions on a higher level than that occurring, a quadripartite between the WHO, OIE, FAA, bringing governments together to develop a consensus on approach, because this is it's a true One Health, but it's also a global issue as well. You look at this studies, there's presentations I saw years ago where they show backpackers had picked up bugs with resistant genes in other countries, from a dodgy tummy, and they can. The world's more mobile now, so COVID's a great example of that, isn't it? The movement we all have. So it is a real, true collaborative effort across the world, and I guess we've all got a part to play in it, really.
I was very excited. Sorry, Margo, do you have a point you want to bring up on that?
I would just add that, I think to the point about this being global, that we need to be collaborating across this, similar to other global issues, climate change, pandemics, et cetera. We need everyone to be doing their part, because otherwise we just won't make the progress we need. And when looking at, the potential restrictions on drug use here in the US, the FDA had an open comment period recently on this topic. And so being responsible users of pharmaceuticals is just critical for us, having the license to use them and showing that we are using them in the right ways. So that piece from a regulatory and government perspective is also important for us.
I think you're really right, Margo. I often talk about there's three constituents to pretty much all of our problems, and that is, government, it's business, and it's individual, and we all have responsibilities as individuals. If I go to the doctors with a little snuffle and I'm demanding antibiotics, then that's not appropriate. Similarly, if I take my cat to the vets and want antibiotics for diarrhea, it's not appropriate. And it's great to see MARS taking this so seriously, across all of their groups as well. What I was really excited about recently, and I know it started last year, but I think it's hopefully going to be even bigger and better this year, is that collaboration coming together of, certainly in the UK, of the pharmacists and the vets with the antibiotic amnesty. I'm sure that not everybody is compliant enough to take all of their course. They're left with antibiotics. They then decide what can they do with them. Sometimes they get flushed down the toilet. Sometimes they get donated to other people for their little tickle or whatever. I think it's really important that this is happening. And perhaps, Ian, you can explain a little bit about the amnesty and how it's going to work, particularly for those people, perhaps as vets who are listening, who can get involved in their practice, but also individuals who perhaps then find out about it and can start taking either their pet's antibiotics or their own antibiotics, presumably back to vet or pharmacy. I doubt if we'll see everybody separating things. Maybe they just got piled into one place.
Yeah. So it's a fantastic initiative. It's a coordinated effort between a number of organisations, the VMD, BSAVA, and also a number of veterinary groups as well, and RUMA are also involved. Both, I think it's RUMA and RCOS Knowledge, I think, have got the resources for everybody who wants to get involved in this. Yeah. And essentially, it's trying to put a real promotion drive on, like you say, making owners and members of the public aware that when you have drugs left over, it's not in the bin or in the toilet. I think it's about a third of people admit to flushing old drugs down the toilet, and our water cleaning systems can remove bacteria and things like that, but they can't remove pharmaceuticals. So inevitably, they end up in the environment and have effects. They can affect acidity of water. Obviously effects on organisms as well. So the amnesty really is to really push and promote for owners to find those old leftover courses of antibiotics and bring them back to your practice. And there's a whole series of information packs. I think there's details on how to how they're collected on the websites as well. And then we want practices that participate to record all the conversations they have about this, but also record the amount of drugs that they've got, submit that to BSAVA. And that's going to be really interesting for lots of reasons. Firstly, what are people, how long, what kind of drugs are they, what kind of antibiotics are they holding on to and not using? But also, if we can track back to what kind of courses they're using, if you've got if we find that, say, a dog with cystitis is commonly getting given 2 weeks of antibiotics and the owners are stopping after 4 days, then that's really powerful information that we can get from this. So, certainly anybody who is aware of it, I would, listening now, I would really encourage them to get involved. It's a collaboration as well between the Midlands NHS as well. So human pharmacies are doing it at the same time. So, but this is, for the veterinary, for the veterinary profession, it's the whole of the UK will want people to get involved. So, please get involved. All the information on the websites, and there'll be, if you're not sure about any of the details, there'll be contact details there for you to ask questions.
I just say to people listening, if you are a vet who's not in the UK or a nurse not in the UK, then this is something that maybe you can put forward to your governing bodies as something that is really important. Encourage your societies to get involved with it, because you were saying before, when they get flushed down the toilet, we know that there's antimicrobial resistance in some of the bugs within the sewage, isn't there, which then can cause all sorts of issues and problems. And I was shocked by the number of deaths across the world that are basically caused by antibiotic resistance. So this is a huge problem, and if we don't get a handle on it, it will only get bigger. It won't get smaller, will it, Margo?
Exactly. It is really an urgent issue, and I think the connection to human health is what really lights a fire under it for me, certainly, but I think for many, that how we use these pharmaceuticals with our pets can directly impact how they work for us as humans in our own healthcare. So, and yes, looking at the trajectory and the potential harm that is predicted is quite concerning. So it's really right up there with climate change and some of the other really urgent crises that we're facing, both as humans, but as other species as well.
Margo, thank you so much for coming to speak to us. I know it's early in the morning in America. And Ian,
not too bad.
Thank you also for coming. It's great to see the work that MARS is doing in this area. Just continue to encourage you to do more, and do pass on those learnings to us, because we all need to learn from each other. So thank you so much. And this has been Anthony Chadwick from the Webinar Vet. This has been VETchat. Take care. Bye-bye.